Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle live in studio. It's beautiful outside. A little hot, but nevertheless, long-awaited summer is finally upon us. Welcome back to those of you who've been out of the area, kind of been out at the sea and in the mountains and cooling off and having a great time. Well, guess what? Reality strikes again tomorrow. You got to go back to work. You're listening to Dr. Tom Roselle, 888-630-9625. That's 888-630-9625. Love to talk to you on any subject that you have in mind. Perhaps you've tried, you've applied, you've done everything you can think about fixing you. Well, guess what? We may have a solution without drugs, without surgery. This is where you find out how to do it. All you need to do is give us a call, 888-630-9625. We have a topic today, one that is of tremendous interest to many of you, one that unfortunately is far-reaching and affects many, many different people. Why? Because it's about something called osteoporosis. That's loss of calcium. And, all you have to do is watch television, and you're going to see every drug in the world that your pharmaceutical agents are going to tell you that you have to take, but it's worldwide, and it causes something in the neighborhood of about 9 million fractures annually. And it results in, get this, about every 3 seconds, somebody's breaking something because there's not enough bone density. In studio, one of my better knowledgeable people on the subject, somebody who's going to be your host, your presenter this Wednesday evening at the Roselle Center for Healing on this particular subject, osteoporosis, is Dr. Matt Adams. Dr. Matt, welcome again.
Good afternoon.
You're becoming an old pro at the show.
I guess so.
I mean, all the nerves now are gone, and you actually come across like, you've been doing this for decades.
Well, that's good that I can appear that way now.
Yeah, I know. I'm very proud of you. Listen, this Wednesday evening, 7:30, you're going to be our host, and you're going to present a very informative presentation on osteoporosis. There's so many people that suffer from this, as we said, something in the neighborhood of just 9 million fractures a year. And that's not talking about the people who actually have this stuff, that they're manifesting in different ways. So let's start out with, osteoporosis is a loss of bone density, period. Okay?
Yeah.
So what are the symptoms that are associated with that? Why should people be, besides fractures? I mean, there's a lot of other things that are associated with this thing. Kind of fill us in a little bit.
Well, I mean, there's symptoms of some bone pain, and there's symptoms of loss of structure. The main thing I notice about this is a lot of times people just don't even realize that they even have it until they go to the doctor and they get a test and they get something, the doctor says, oh, you have osteoporosis. Or they go because they've got some back pain and they get an x-ray and they show on the x-ray that the bones are kind of porous, less dense. Oh, you have osteoporosis. All the time people come in and they're like, I didn't know I had this. How did I get this? What happened?
Yeah, and unfortunately it doesn't show up except for an examination, and the typical medical approach to examination is bone density. So when somebody hits a certain age, they're going to ship them off to do a bone density measurement, and they say, oh my gosh, this is what you have. Well, the problem here is simply very straight up. Until you have at least 30% loss of bone density, 30% loss of your substance in your bone, it can't be picked up on x-ray. And when you get to 30%, then it's called osteopenia, which is a loss of calcium. Osteoporosis actually is something different. What is osteoporosis? What does it look like?
Well, osteoporosis on an x-ray or up close, I mean, you use the term porosis, which means porous. So you get these large porous holes, less dense structure. in the bone, and that's why it makes it more brittle. The interesting thing about it versus osteopenia is really osteopenia just means you're headed towards osteoporosis, and that gives your physician time to say, okay, we're going to watch this, and then when it becomes osteoporosis, we'll intervene. Where really, at that point, you should be intervening a long time ago, and it's ready to start now before it gets to osteoporosis, because that's what's going to happen.
Well, one of the things that shows up, and we've seen, in our office and my career over the years, is osteoporosis produces significant pain in the body. It's overall bone pain. How does that show up? Why is the pain there? Why should this intractable? A lot of people call it's fibromyalgia, and it's chronic myofibrosis, or they put a lot of different terms in it, but sometimes it's simply bone pain. And what's the matrix behind that?
Well, if you have bone that's weaker and it's having different forces act upon it, due to what we call subluxation, where the misalignment's there. So now your body has extra stress on it, trying to hold it in place, and it just feels weaker. Anytime you're trying to hold something for a long period of time and you're weaker than normal, you're going to feel it too. And I think a lot of times that can transfer with the bone pain. Also, now you've got a calcium imbalance between in the bone and outside of the bone, which is going to stimulate all types of different neurochemistry that can show up as pain in your body.
Everybody's out there thinking, okay, osteoporosis is a female problem. They're the ones that all the marketing is kind of guided towards, and going to take this drug and that drug. And there's actually two different forms of medications, and one's a bisphosphonate and the other one is a hormone treatment to maintain calcium balance. That's where they're going to start using estrogens and so forth to try to maintain the matrix. However, the problem exists also with men. And men can be as significantly and sometimes more adversely affected than women can. What's the statistics on that?
The statistics, I think, with men, it's like after the age of 50, you're looking at 1 in 5 men, and worldwide. Women, it's 1 in 3. But we focus on women so much because we know that they undergo a lot of different hormone changes with estrogen.
But so do men. Our foolish society says that only women go through menopause, but guys go through this thing called andropause, which is exactly the same thing.
But we don't think about that because that would make us seem less manly.
Yeah, you're macho. That's all. We think that we're impervious to this type of situation, but the truth of it is, men have hormones that get screwed up too.
Yeah. So when the hormone balances get off, that affects all types of things that regulate your bone, because bone is a living thing. It's not just like a hard, solid piece of metal or rock inside your body. It is living, it's rebuilding, it's taking old bone off, and all these hormones, they regulate your thyroid and parathyroid and all these other different things that are going to regulate your bone making. And so
let's talk about one thing that is kind of common to everybody today. We're talking about hormones, okay? We kind of put our foot in that. What does that have to do with osteoporosis? Well, the one piece that we look at is estrogen, and high levels or deficiencies of estrogen. Actually, both ends can cause a problem. And so today what we have is we have all of these, and we've talked about it many times in this program, is we have all these xenoestrogenics that are floating around in our atmosphere, so guys are as susceptible to it as women are. But that's just a kind of a note at the bottom of the tail right here. But men also have problems that cause osteoporotic conditions, and they show up for some reason a little bit more in men than they do in women. And we're talking about parathyroid. The parathyroid controls. It's the conductor. It's the one that handles calcium metabolism throughout the body. What's so important about that?
Well, the parathyroid regulates. It says it looks in your blood system, and if there's a lot of calcium in your blood, your parathyroid goes, oh, okay, I need to take some of this calcium and put it into the bone. And so that's its main regulating, because if we get too much calcium thrown through the blood, that affects muscle contraction, affects nerve receptors, a lot of things. So, but it works in conjunction with our thyroid as well. It also has stimulation from the hormones, and that's why parathyroid is real key, and the hormone balance is real key with it.
So here's the $1 million question. If somebody has a problem with thyroid, they're hypothyroid, are they also going to have a problem with the parathyroid?
Well, definitely, yeah.
So one affects the other.
Of course.
Okay, so because you got 4 little parathyroid glands, right? They're embedded in the 4 lobes of the thyroid, and anything that affects the thyroid is also going to affect these glands, and it's going to affect the capacity of these 4 little glands, these little parathyroid glands, to work.
Well, yeah, your parathyroid, when it notices that it needs more calcium in the bone, talks to the thyroid and says, hey, we need more bone. That makes calcitonin, which then tells your bone through what we call osteoblasts to start bringing more calcium into the bone. So if you have, when we see this all the time, hypothyroid, that's a pretty common thing people hear. When you have hypothyroid or problems with the thyroid, now you're not getting the communication real well, or the thyroid's not working. And that's why you have to look at everything. You know, the body is a really complex system. Just throwing calcium or vitamin D at it is not always going to fix a problem.
No. Matter of fact, if you put too much calcium into the body, we're learning now that it's actually going to feed back in a negative loop cycle and cause more problems than what we're trying to fix. So you have to have, probably less is better in this situation with a lot of different minerals. 888-630-9625. That's 888-630-9625. Love to talk to you on any subject you have in mind. We're talking about osteoporosis, loss of calcium from the bone tissue, a porousness, if you will, going from what? Osteopenia to osteoporosis and pain. And pain is one of the keynotes of this thing, and then also ultimately fracture, not only of the long bones, but also the spine itself. And that's, you see these people, Dr. Matt, that can't stand up straight anymore. They're kind of bent over. They got these humps. Mm-hmm. That, in fact, comes about because of osteoporosis.
Yeah, we call it, it has a term, a Dowager's hump. And what happens is, whenever we start to go, you know, from all the different things we do throughout life, causes us to lean over or postural imbalances, when you get pressure on the bone at a different angle, you've got decrease in density. Now that extra pressure causes little fractures in the bone. And so the more fractures, we get these little fractures going forward and forward and forward, causes these big humps to come up, and now we're stuck in a position. And forward, sorry, you notice my voice was getting lower as my face got lower on the microphone.
Over as you're talking, yes, I'm watching this. It's painful to watch you do this. My guest in studio, your host this Wednesday evening, the 10th of July, 7:30 p.m. at the Roselle Center for Healing in Fairfax. Dr. Matt Adams, he's going to be talking to you on osteoporosis and what you can do about it naturally and get off these foolish medications that have tremendous amount of side effects that are causing you more destruction and more devastation than you can possibly imagine. We're going to talk about that in the second part of the program. But if you'd like to know how to do it, how to really get your life back, how to fix these hormone imbalances, but also get rid of the pain, give us a call, 703-698-7117. That's 703-698-7117. And tell my staff that you'd like to register for Dr. Matt Adams' presentation this Wednesday evening, 7:30 p.m. at the Roselle Center for Healing. The 10th of July. God, the 10th of July. Not too many days left before Christmas, buddy.
It's getting close, kind of.
It just kind of goes by so fast it makes me crazy. I mean, the 4th of July is over, and when the 4th is over, it's like the summer just goes, boom, it's done. And I don't even want to think about that. Anyway, give us a call, 703-698-7117, if you'd like to attend this Wednesday's presentation, our in-house continuing education program. Remember, these programs are our gift to you. It's a community service. It's based on our relationship with a foundation called Caring for Others, and we try to give you as much detailed information as we can. So if you'd like to be there, real simple, call us, 703-698-7117. Got to have a reservation, though. Can't show up without one. Have to have a reservation. So give us a call. Real quick, we got less than a minute before we have to take a break, so I want to ask you a question. In the spinal system, the osteopaths call it spinal lesion. Chiropractors call spinal subluxation. They're both misalignments of the spine. They can cause a localized osteoporosis. Less than 30 seconds. How does it do it?
Well, if you have misalignment causing pressure, your body is going to think to put more calcium in there to handle the extra pressure. We call Wolff's Law. And so if you get extra calcium on one side, pulling away from the other side, it can cause a little decrease in density on the outside, causing pain, causing arthritis, and helping to form osteoporosis over there.
Almost like putting a cast on a broken limb. If you don't move the part, you lose calcium, you lose minerals. You can't function the way you should. Got to take a break. We're coming up for some very important messages, and people bring Dr. Tom Roselle live to you. We'll be right back.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.
This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live. Yep, we're in the studio. It's hot outside, and it's nice and cool in here. But nevertheless, many of you are back from the beach or coming back, or you're out in the mountains and you're returning. Take it easy today because the traffic is going to be very, very, very heavy. Just listen to me for the next half hour, and we'll give you information you can process so the time will pass very, very quickly. In studio, Dr. Matt Adams will be your host, your presenter, Wednesday the 10th, this coming Wednesday evening, 7:30 p.m., at the Roselle Center for Healing in Fairfax. What's he going to be talking about? Osteoporosis, the loss of bone substance that causes fractures and pain and impairment and disability. It's avoidable. It's fixable. You can find out without an x-ray. There's things that you can do. And we're going to talk about those things. We're talking about your drugs and the things that you're taking in the second half of the show. If you have a question, you'd like to know how to make this all happen, just give us a call today at 888-630-9625. That's 888-630-9625, and call my staff at 703-698-7117. That's 703-698-7117. Before we get back into the program, I want to give you a heads up. Mark it on your calendar, July the 28th at 2 p.m. What's happening? Well, many of you heard about our Ageless Health PBS television special, and you know that it was nominated for 2 Emmy Awards. It's off the top, a phenomenal, hard-hitting, impactful documentary on what can happen when you have patients who make a decision that have MS and who have seizure-related allergies and ADD and all kinds of body pain and so forth. Anyway, this was nominated because of its specialty and because of what it does, and we'd like to offer a special viewing to all of you. The Angelica Film Center, the Mosaic in Merrifield, Fairfax, Virginia, we have rented that theater for you, July 28th at 2 p.m., and we're going to have a special showing of the Ageless Health special. I'll be there. I'm going to meet and greet and shake your hand and talk to you about it. And all we're asking you for is a $10 donation to Caring for Others, which is a 501c3 foundation. You'll get a receipt for that. It's very inexpensive. And if you buy 3 tickets, you can get 3 tickets for a $20 donation to Caring for Others. Now, all we're asking you to do is go to drtomroselle.com. That's Dr. Tom Roselle, DrTomRoselle, and sign up and reserve your seats now. You don't have to pay for it online, but there's a whole bunch of information. And then when you're there that Sunday, the 28th, then you can pay for it there. Okay? So I'd love to have you. Please come and see this. I'm very proud of what's taking place. It really shows what can be done. So if you really wanted to know what the outcome of integrative care really is, this is your opportunity. Let's get back and talk about osteoporosis. Dr. Matt, osteoporotic conditions, as we said, men and women, we said that can affect anything. We were talking about how it happens in the spinal system. One of the things that causes osteoporotic conditioning to come about is simply the lack of function and motion that's due to what we call subluxation or spinal lesion. How does that occur?
Well, your body needs stressors on it in order to tell your brain that it needs bone formation in that area. And we see this with, they've done studies with tennis players. You've got, if you look at Roger Federer's right arm, it's a lot bigger than his left arm because that's the one he uses. And they've done tests to show that there's higher bone density in one arm than the other. Astronauts, we've seen tests where when they're in space, there's no gravity, no pressure on the spine or on the bones. They have less bone density when they get back. So if you have a condition where your body or the bones in your body are misaligned and not moving like they're supposed to, because there's constant motion that needs to take place in your spine, if it stops moving, you have a decrease in what we call mechanoreceptors, or feeling the pressure of movement of bone there. Your body is going to stop sending the calcium and bone reinforcements, and so you're going to start losing bone there. You use it or lose it. That's the term we hear.
So it can be lack of pressure due to gravity, like that happens with astronauts in space.
Yes.
It can be a cast. It can be lack of exercise activity. You're just sitting around. Or it can be the spinal subluxation that we're talking about, the spinal lesion that the osteopaths look at. And it's simply that once the vertebrae, and I make sure that it's right, is out of position, then we have this lack of demand, if you will, for mineralization. And the body says, don't need it anymore.
Exactly. I mean, it's not moving well. It may be not moving at all. We see this a lot of times with people. If you look at your spouse or your friends, see how well they can move their neck. You should be able to look over all the way to each shoulder, or look up, eyes parallel to the ceiling, and you can see if their neck looks straight or it's forward. And if that's the case, you know that there's joints in there that are stuck together, and they're not sending the signal, and they're not getting the things that they need.
Many of you are calling in, and we're going to get to your questions after we come back from the news, so don't go away. Stay in there, and we will make sure that we are very, very specific and attentive to your needs. You're listening to Dr. Tom Roselle Live, and my guest in studio, Dr. Matt Adams, and we're talking about osteoporosis and those things that can be painful and make you fracture unknowingly. Don't go away. We're coming up to the news and some very important information. This is Dr. Tom Roselle. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We are in studio, 888-630-9625. That's 888-630-9625. My guest, your host this Wednesday evening at the Roselle Center for Healing, talking on osteoporosis, Dr. Matt Adams. We're kind of taking the voodoo off of the subject and letting you know what the real problem is. We're going to get your calls, and we have a couple of very interesting ones online, so we're going to do that right away. Elizabeth, thank you for calling. How can I help you?
I was curious as to whether you had anything to say about the medication Forteo.
Oh, I've got a lot to say about that one. Lots. First of all, it's one of the most dangerous medications out there. And
that's because
it increases
the black box warning?
When you finally get the drug companies to put a black box warning on something, you know that they've got a major issue on their hands, and they want to say, yeah, this stuff works, but you're going to take it at the risk of developing cancer and causing your bones to break down and causing your liver a problem and so forth. It's matter of fact, if you go into any of the drug websites and look the drug up, you're going to see that they tell you do not take this thing. Even from them, do not take it more than 2 years. They tell you don't take it if you're pregnant, if you're breastfeeding, and it goes on from there. So it dramatically increases the risk also of bone cancer in animals in a very, very quick way. So it's not a drug. It's injectable, as you know. And it's one that I personally think is foolishness and craziness. And any of your, this Forteo, Dr. Matt, go ahead. I'm stealing this because it's one of these drugs that makes me crazy. So go ahead and jump in and go ahead and talk to her about it a little bit.
Well, I'm thinking a little bit about, you're putting in parathyroid hormone, and anytime we are giving ourselves hormones also, the interesting thing is they want you to get off of it in 2 years. If you're supplementing yourself with hormones for 2 years, your body gets used to that. It's not making, it's really not making much at that point either. So now after you get off of it in 2 years, you've caused your body to get used to getting supplemented. So now what are you supposed to do? Because you're going to make even less than you were before when they put you on the stuff. So
Forteo is going to stimulate the production of calcium by putting in a man-made parathyroid hormone. It's not a natural hormone in any sense of the term. And as we said earlier, it dramatically increases your risk of certain types of cancers, one of them being bone cancer. And when we know that you can turn majority of, as long as you have parathyroid glands and as long as you're doing things methodically to change the loss of calcification in your body, you can turn most osteoporotic conditions. As a matter of fact, the greatest majority of them can be reversed and turned around with dramatic increase in bone density. We have the studies, and you can tell. The question in my mind for this, and Dr. Matt, you can jump in on this, is that if you're taking a parathyroid hormone that is supposedly necessary to reverse something, what caused the problem to begin with? We just talked a little bit about thyroid problems. Yeah,
I mean, the bigger question is, why are we not getting calcium into the bones? And so figuring out, okay, do we need more magnesium to balance with the calcium? Do we need some more stomach acid to break our calcium down and absorb it? Maybe our small intestine is not absorbing the calcium we're taking in, and that's why it's not getting there. So I think it's better to ask the question where the dysfunction is in the body and work to fix it versus give something that you're not really deficient in, that it can cause more side effects later.
Also, you have to remember that any calcium substance that you put into your body and that's unopposed, meaning, for example, even if you take your regular calcium and you're not balancing it with things like not only magnesium but boron and strontium and manganese and vitamin D and C and so forth, if it's not transporting properly or if you have way too much of it in your system, you're going to impair neurological function as well, particularly in the brain. And what we've seen with drugs like Forteo and also people who have just kind of loaded up on all sorts of calcium is that it impairs brain function and neurological transmission, which also will lead to muscle spasm and tetany and things of that nature. So we could go on, Elizabeth, but it's not a good drug, and I think that you'd be well advised to look at other things. If we can help you, I'd be more than happy to advise you. You can always get a hold of me at drtomroselle.com or give us a call, make an appointment, see one of our docs, or make an appointment with our nutrition department.
Come hang out with us on Wednesday.
Yeah, come hang out with us on Wednesday at 7:30. Dr. Matt will give you the skinny on this drug and many other drugs as well. 888-630-9625. That's 888-630-9625. Love to talk to you on any subject you have in mind. And if you'd like to attend Dr. Matt's presentation this Wednesday, the 10th of July, please do so by calling 703-698-7117. That's 703-698-7117. It's a public service event. We do this for you because we want to give you as much information as we possibly can. Remember what our mission is and our purpose is. We're here to serve you, to educate you, and empower you, to allow you to be in control of your own health, to allow you to turn your life around. We're your guide. We're the educators. We're the guys that can help you to a certain piece, but you've got to be a partner in this. And that's why we do the program. That's why we do our in-house programs. That's why we get involved with programs like the PBS special, Ageless Health. That's why we do all the things that we do. Dr. Matt, let's talk a little bit about some of the other medications, and because these are things that people want to know about because they've been put on these drugs and they've been told, they have to do it for the rest of their lives and there's no reversal, there's no turnaround. There's things like, there's a class of drugs besides the hormone replacements called bisphosphonates, and they are a problem. And, let's talk about those for a minute.
Well, they're a big problem. There's more and more studies showing up that they really don't make a difference. And in fact, most of the time you have increased fractures while taking these, which to me is I just don't understand why we keep giving these out and why we keep putting these out whenever we're seeing more and more studies where they're causing more and more problems.
Well, you have, Boniva is one, Actonil is another. They are very specific medications that do a lot of damage.
Yeah.
And that's being kind. They do a lot of damage, but they also will cause things like the deterioration of the jaw. They actually lose bone density from the jaw. They're supposed to strengthen bone, but Dr. Met, how do they strengthen it?
Well, they strengthen it, at least supposedly strengthen it by stopping your bone from getting rid of old bone, in a sense. So you have what we call osteoclasts that take the old tissue of the bone and pull it out. Because, our body's constantly regenerating, and we have to get rid of the old stuff to put in the new stuff. And if we inhibit the old stuff from getting out, we're going to get buildup in there, which will look good for density case, but over time, when you get that old tissue and bone in there, it's not very strong.
There's an interesting commercial out there, it's about Actonil. And I sit there with Sue when we watch these commercials, and we're always dissecting them. We're making comments on them. And one of them simply says, if you can't sit or stand for 30 minutes, after you take Actonil, don't take it. And, you have to be upright. You have to stand upright. And the reason for that is simply because it causes erosion and destruction of the esophagus. So if you have any chance of regurgitation, if you have any problems, and they tell you, take an Actonil the first thing in the morning with a lot of water and be able to stand up and don't lay back down for 30 minutes, then this drug might get down without any trouble. Really? Gloria, how can I help you? Thank you for calling.
Oh, yes. I wanted to find out whether or not bone loss and osteoporosis are related in any way, and if it can be repaired in your teeth.
Well, bone loss and osteoporosis, Gloria, are generally same type of mechanism. Osteoporosis, when we talk about, we can have a localized osteoporosis, as we've talked about, where the bone, you've either put a cast on it or you have a joint space that's not working, so you begin to lose calcium because of the lack of demand of that mineralization. But bone loss can happen with the same type of mechanism from a lot of other things. What do I mean by that? Well, the medications that we're talking about, they actually have a negative feedback loop that will cause that to occur. The problems with the parathyroid, which we talked about, imbalances in hormones, which we talked about, and guess where they show up? They do show up in the teeth. You have to have what's called an alkaline system for bone to be deposited in. Unfortunately, the SAD diet, the standard American diet, breeds acidity. It makes the environment worse. So you pull calcium out to balance the acid. So you have this balancing act that goes on, because if your body remains acidic, you burn through structure.
Well, I have an interesting story about this. I went to a seminar from Dr. Gaeta, and he had a call in about a child who was really sick, running a real high fever. And the mom said, was describing it, and then she said, and his teeth are starting to turn gray. And he went, oh. So he said, I need you to get them on a lot of calcium. And the interesting thing is, you need calcium for your immune system to make white blood cells to kill off infection. Calcium's used in a lot of different areas, and so just like we talked about the alkaline diet, whenever you get more acidic, you need calcium to go buffer that. When your immune system needs calcium, your teeth can get affected. And so once they increase his calcium intake, the fever went down and his teeth started to turn more white because it was sucking the calcium out of his teeth. And you can think about the bones as well. You can't see them, but they were probably getting calcium sucked out the same way. And so calcium can work in conjunction with teeth and bone in regards to regulating, buffering, all these things that your body needs calcium for. It steals it.
Gloria, I'd love to have you as our guest this Wednesday evening. Give us a call if you'd like to attend, 703-698-7117, 7:30 this Wednesday the 10th at the Roselle Center for Healing. Nicole, how can we help you? Thank you for calling.
Hi, Doc. Real quick question. You may have already answered it, but I have a family history of osteoporosis, and my doctor wants me to go on to hormone replacement therapy. Does that increase my likelihood of getting osteoporosis, and are bioidenticals better to take?
Well, if you're going to, you never take a hormone replacement therapy unless you can get your system to turn itself around. And so many times, hormones don't work in the body because of high levels of inflammatory response due to many things, whether it's allergy reaction or heavy metal toxicity or injury patterns or stress patterns or what we call the SAD diet, standard American diet, because it's so highly acidic. So you look at all those things. So if you have a family history of osteoporosis, the first thing you look at is the dietary patterns among the family the same? Are the exposures environmentally the same? Xenoestrogens, all the pollutions in the air, all the runoffs and so forth, are all those things the same? So you could have a situational family problem. Can there be a genetic predisposition? Sure. Now, how does that occur? The genetic predisposition can come from a problem with early menopause as far as women are concerned, and so you get an imbalance in estrogen progesterone. So we can go on this topic, obviously, for a long time, and we're going to do a program on female hormones again. We just had it in the office a short while ago. But what I want you to think about is, what's your diet like? What's your exercise level like? Are you too heavy? Are you way too light? You can go be either way. If you're way too much weight, or if you have a tendency to be extremely thin. Are you get outside? Do you get a lot of sunlight, or do you kind of, do you live in a cave all the time? Are you getting, the exposures of the things that you need to get? So there's no yes or no answer on that, but there's a lot of things that you can do to reverse that without drugs. Love to have you. Why don't you come up to the class on Wednesday evening and be our guest? We'll answer your questions more specifically. And as always, drtomroselle.com is how you find me, and more than happy to answer your questions online as well. We'll be right back after some very important information. Don't go away. You're listening to Dr. Tom Roselle. Be right back. This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health, Health is a Do-It-Yourself Program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself Program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
If you're looking for the best in natural health, wellness, and green living products, shop the Roselle web store on Amazon.com. You'll find a variety of products and resources that are designed to help achieve an ultimate state of health and wellness. Shop the Roselle web store on Amazon.com today. Visit drtomroselle.com and click on Roselle web store. That's drtomroselle.com and click on Roselle web store.
Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We're here every Sunday, 12 noon, bringing you the most intimate information on integrative and natural therapies. If you've got a problem and you want to find out how to get off the drugs, this is your opportunity. This Wednesday evening, Dr. Matt Adams, your host, will be presenting a very detailed and intimate conversation on osteoporosis. I want to remind you before we get back into the subject that the 28th of July, Ageless Health, the PBS documentary that we were involved in, was nominated for 2 Emmy Awards, and we have made it available to you at the Angelica Film Center at the Mosaic in Merrifield, Fairfax, Virginia. Love to have you. It's a $10 donation to Caring for Others. They're sponsoring it, and you can actually make a donation of $20 and get 3 tickets. No money transacted right now online, so all you have to do, though, is go to drtomroselle.com, drtomroselle.com, and register. And just, fill it out. You have to register because, we have to fill this place up. But we're doing it for you. We're doing it to make you aware of this. All proceeds go to Caring for Others. Nothing goes to us. It all goes to Caring for Others. $10 or $20 for 3 of you. So you have to pay at the door. And we're going to be there to answer your questions, before and after the presentation. Love to have you. The 28th. Get it done now. This Wednesday, the 10th, 7:30 p.m. Dr. Matt Adams, talking about all kinds of wonderful things with loss of bone density. However, we have a couple minutes left, and I'm going to answer a question real quickly. Charlie, thank you for calling. How can I help you, sir?
Hello, Dr. Roselle.
Charlie, yes, sir.
Yeah, great show. Thanks a lot.
You're welcome.
My question is about, I've heard something on a previous show about vitamin D for Parkinson's. I want to know how much to take is safe, and what else you do for Parkinson's, and is homeopathy involved? Okay,
there's tons that you can do for Parkinson's, and we approach it from neuromuscular balance, cranial manipulation, acupuncture, low-energy light laser, things of that nature. You have to find out if the body's toxic, heavy metal detoxification, if the gut's not working. So let's answer the question specifically of vitamin D. I'm going very quickly because we only have about less than a minute. Vitamin D levels are critical. In all studies that have been done, vitamin D levels are extremely low, if not or very, very deficient in Parkinson's patients, as well as what we call medium-chain triglycerides. So how much is safe? You can, if you're really, really low, you can take 10,000 units a day. And I don't like a big blast. I want a natural form, and I want it spread out through the week. So 10,000, sometimes a little higher, sometimes a little lower, depending on the patient. But you also have to clean up the intestinal tract. So, Charlie, I'm sorry I can't spend a lot of time on it, but if you go to drtomroselle.com, I will respond to you. Just let me know we had this conversation. Dr. Matt, we've got about 40 seconds. Give us a synopsis on Wednesday evening.
All right, we're going to talk about bone loss. We're going to talk about how to reverse it. We're going to talk about why we've talked about hormone imbalances. We've talked about diet. We've talked about subluxation. We're going to explain this. You've got little pieces so that you can know how to turn this around. It's not a lifelong thing. We can get your bones healthy,
it can be
working again. It can be fixed.
703-698-7117. That's how you register for this Wednesday's presentation. You're listening to Dr. Tom Roselle Live. We're here every Sunday. We'll be here next week as well, bringing you more information, things you can think about. Remember, as always, don't believe anything I say. Do your own homework. Do your own research. I'll see you then. Bye.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.